Barbadians continue to flock to centers across the island to receive the COVID-19 vaccine. And co-coordinator of the National COVID-19 Vaccination Programme here in Barbados, Dr. Elizabeth Ferdinand, believes at least 70% of the population needs to get the jab to achieve herd immunity. Exactly who would you recommend to take the vaccine?
Well, let me say first of all, eventually every one of us should take it, at least those over 18 for now. But because the disease is affecting the elderly people, the people who have chronic diseases that are not well controlled, those are the first set of people that we need to have it. The second set, of course, are the front runners. In other words, the people who are interacting with the public, interacting with visitors who come, and those are being exposed to the virus. And of course, the people who are caring, all the nurses, the doctors, the attendants in any way, the ambulance people, those people who have to collect people who are ill, take them to hospital, take care of them while they're in hospital or even in isolation or quarantine stations, the people in the hotels who have to deliver food and clean up and clear up after these people who are there, they are our first priorities. Right? But eventually, and I hope in the very near future, we will be extending to all of Barbados, because Prime Minister has assured us that she's seeking to get many more vaccines. And I believe what she says, and I'm hoping that the day will come soon that we will have extra ones in place that we can use them.
We're here at Harrison College, one of the centers. Talk me through the process in terms of getting the COVID-19 jab.
Okay. Well, of course, first of all, you have to, or you should have an appointment to come, because right now we're doing appointments only. So someone would have called you, you've either applied or made some application to get it, and you would have been called and told to come. You line up and you go in then to the first place where you are going to give your ID. You're given a blue card, and your personal information is taken, like your name, your address, telephone number, date of birth, and ID number. And then from there on, once that is entered into the IT system that we have, now the government has a central health system where you put into that system. And once you've been put into the system, you're there all the time. So if next year you go to one of the polyclinics and you say, my name is XYZ, they will go in there and they will find XYZ, okay? So that's where a lot of the hold-up is, because it's a manual process in the sense that it has to be entered into this, by computer, into the repository. Once you finish that, you will then go to the actual place where you're getting the injection, okay? So the nurses then inject you, and with the vaccine, and from there you go then to what we call the recovery area, where we need to keep you 15 minutes at least under observation, because we just don't know if you're going to get a reaction. So we keep you for 15 minutes, and while you're sitting there, you're supposed to be having the last part of the process is that another set of volunteers will take some information from you, like your email address, because the idea is that after we've finished your second dose, you will get your certificate on an app on your phone at your email address, so that if you have to travel, you will have it right there. Or if you've lost the blue card, because a lot of us lose our blue cards, or not that we lose them, but we might misplace them. So you will have a backup. You will have it electronically, and you will have the blue card. Okay, so that's the process. And after waiting the 15 minutes, you're free to go. And nurse will tell you, sometimes they do a little talk before, and they tell you, what you're going to expect, and that when you go home, if you get a little fever, if you get a painful arm, you can take a Panadol or two. Drink plenty of fluids, don't do a lot of physical work in the sun, And within a day or two, you're back to, I didn't have many side effects, you're good to go.
What are some of the most common side effects from the vaccine?
The common side effects that we've been finding is, of course, pain where you've been stuck. So, I mean, some people might have a tiny lump, but most of it is a little painful if you touch it. Mild fever. And sometimes you get, as if you're getting a cold, you feel, a little chilly, or sometimes pains in your muscles like when you have the flu. Those are the most common. And funnily enough, seem to be more common in the younger age group. The oldsters are not getting much side effects, right? I know that also some of the young people have complained of some nausea and even vomited once or twice. But that's like 12 to 15, 16 hours after the injection. So like in the night, they get up around 2 o'clock, they're feeling chilly, they got to put on a blanket or sheet or cover up. They feel a little nauseous and they might vomit. But generally speaking, only the younger ones seem to be getting those type of symptoms. Some people do get allergies, like a rash or so, but those have been very few.
Did anyone have to be hospitalized after taking the COVID-19 vaccine here in Barbados during the 15-minute period or after?
At this moment, up to today, no. We have had 2 cases that had to go down to A&E and spend 4 hours to be kept an eye on. One person I know for sure is very allergic, and she normally carries around with her what we call an EpiPen, so that if they, by any chance, they get a bee sting, which is they're allergic to, or they eat nuts, inadvertently or something like that. So they have to use that pen. So people like that we tend to only do in a clinic setting or at the hospital. So somebody like that, not that they were very bad, but they had to be kept for observation. And I think there was another person whose tongue started to swell a bit. So we didn't take any chances. You give your first aid treatment, your adrenaline and what's not at the site, and they were transported to A&E to be observed for 4 hours, and then they were fine.
Were there any reports of persons contracting the virus having taken the first dose?
I have not had any reports of that, and I can't, but it's very difficult to say, but we're not sure.
We've seen the virus here in Barbados. A lot of elderly people have contracted it, unfortunately passed away from it. Why would you say is this happening?
Well, this is a new disease, and new things will happen. We know and we found out that it affects the elderly population worse than the younger ones. So a diabetic who might be hypertensive or have other complications, the kidneys not working properly, or their lungs might not be so as good, and they get the disease, somehow or other the virus gets into their body and into those parts of the body like the lungs or the kidneys, and affects them, and they shut down, they stop working. So they can't breathe. The fluid collects in their lungs, and they have to get ventilated to try and squeeze the oxygen in, and even that sometimes is not enough. So we're all getting older, and with aging comes certain things that we don't like, we're not happy about it, but it's inevitable. So your body is worn out from all the years and all the diseases and so on. So when this disease comes, it seems to attack the elderly much more than the younger person.
Tell us, what can caretakers of the elderly do to protect them?
You're talking about caretakers to protect themselves or protect the elderly?
To protect the elderly.
Okay, well, first of all, those elderly who are up and about, around and about, they should stay home as much as possible. I should be home, to tell the truth, but I'm out trying to do this. But I'm not going out unnecessarily. I don't know when last I've been to the supermarket, and what is happening, as we get older, we get lonely. We need friends around us, we need people around us, we socialize more. And with this lockdown, and not only the lockdown, but with us having to be told or asked to stay home, as I would say, it's not in our nature to be home alone. So we want to go out. So as a caretaker, as a family member, as a friend of somebody who is elderly, encourage them to stay home as much as possible and do not go out unnecessarily. Get on the phone, talk across the fence to the neighbor. You know, if somebody drops in, let them stay on the gallery or the patio outside and you inside, and you talk to them in a mask. You know, don't, as a young person or a younger caretaker, go in there, and then after you've seen or tended to the elderly person, you go out and socialize without your mask. These are things that carers can do to try and encourage the elderly to stay safe.
The vaccine is not approved for children. What precautionary measures can parents take?
Well, if the parents keep well and do what they have to do, that would stop the infection from coming into the home. We're not at school now, so they're not going to be exposed at school, but they will get exposed at home or at their family around the houses around. They can encourage the children to wear a mask when they're going out, to wash their hands thoroughly, and try not to touch their face or suck their finger. And you know how hard it is when a child sucks their finger to stop that. But these are the things, they're touching all around, and they're going to put the finger in their mouth and they could catch it. And you know, children learn fast. They know they have to wear a mask, they know they have to wash their hands, they know they're supposed to stay far away from others. And if you instill it in them, they will grow up and learn to do that, because this thing is going to be around for a while. And so they must learn as they grow older to protect themselves.
Earlier in the interview, you mentioned about persons coming to the center if they had appointments only, but a lot of people have been saying they've had appointments but not receiving the call. What exactly is going on with the system?
Well, in my opinion, I think the system is failing us. What is happening is that I don't really know a lot about IT, but we had hoped that it would be quite simple and easy to arrange an appointment and for people to keep their appointment. But if as you said, people say made an appointment in February and they haven't heard anything, they get anxious, and so they say, well, I'm going down to the center, I'm going to the clinic, I'm going to line up and I'm going to wait. And of course that causes a bottleneck between the people who have appointments and those who are walking in for one reason or another. So I think in our second round, we have to look seriously at the appointment system. We did try to make some changes recently, where when you register, you actually get back a reply giving you a time and a date and a venue as to where you're to go. We've just started that, and I don't know how it's working really. So we're testing that now. And if that works, then that should be in the future, next week or so, we will start with that. But right now, I am not perfectly happy with what has gone on with the appointment system.
Final question is, how far do we have to go as an island to receive, herd immunity?
I would say we have to try to get up to 70% coverage. So in other words, 70% of our population should be vaccinated to get this herd immunity. We know that the children under 18 are not getting a vaccine at the present time. So we have to have quite a lot of adults then immunized to have a herd immunity. And when you have the herd immunity, it prevents you from spreading the disease, it prevents you from getting disease, and it prevents pockets of unimmunized persons from accumulating in certain areas or districts. You understand? Because if a community, any community in Barbados, this village or so says, none of us having vaccine, you can realize that is where you have a pocket of people who can be easily infected. And that's what happens. So we have to try and guard against that and try to make sure that across the country 70%. I'm aiming for 70%. Of course, I'd be happy if we could get up to 80%. But if I get 70%, I would be happy. No, just please keep safe. Do what you know you have to do. Come for your vaccine. And for those of you who have had your first dose, you have to have a second dose, unfortunately. But you know, it wasn't a hard stick, so nothing to be afraid of. So come up when you're called or when you know you have to come and get your second dose.